Welcome back to the deep dive. Today we're doing something a bit different, really getting hands-on. You've given us your personal revision notes, zeroing in on one specific medical condition, and you want a really high-yield breakdown. Our job, to pull out the absolute must-knows from these notes, make them stick.
Exactly. We're taking these Cryptosporidiosis notes and distilling them, boiling it down to the essentials, covering all the key bits you've highlighted.
Okay, so crypto. At a very basic level, it's a parasite, causes diarrhea, but clearly there's more to it from your notes. Let's make this complex stuff feel, manageable, easy to recall. Right then, let's unpack Cryptosporidiosis. Starting with the definition, just like in the notes. What exactly is it?
Okay, so basically it's an infection caused by a tiny parasite, a protozoan called Cryptosporidium. It mainly hits the gut, the GI tract, and the main thing people notice is diarrhea. And your notes rightly point out this isn't some obscure thing. It's pretty common globally, and here in the UK too. The main culprits are usually C. hominis and C. parvum, and it's mostly spread through water and food, the faecal-oral route, though interestingly, the notes mention respiratory spread too.
Okay, and here's where it gets really interesting, right? The notes flag this early on. It's resistant to a lot of disinfectants, including chlorine.
Yeah, that's a huge point. That outer shell, the oocyst, is tough.
So normal chlorination in pools or water supplies might not kill it?
Often not completely, no. Which is why you get those outbreaks sometimes, even in places you wouldn't expect.
Right. So that's the what. How about the how? Etiology. How do people actually catch it, according to the notes?
It all comes down to swallowing the parasite's oocysts, these microscopic cysts. They get shed in the poo of infected people or animals. And then they contaminate things. Water's a big one, but also food, soil, even just surfaces. So the notes list the main ways: person-to-person contact, drinking contaminated water, or eating contaminated food, or just touching a surface that's got oocysts on it and then, touching your mouth. And these things are hardy. They can survive out there for a while.
Okay, makes sense. So who's particularly at risk, especially for getting really sick from it? Your notes have a list of risk factors. Let's try and make these stick. First up, weakened immune systems. This seems like a really big one.
Definitely. The notes mention people with HIV/AIDS, transplant patients, anyone on chemo. Basically, if your immune system isn't firing on all cylinders, it struggles to clear the parasite. So the illness can become really severe, really prolonged, much worse than in healthy folks.
Then there's close contact. So places like nurseries, daycares.
Yeah, households too. Just being physically close to someone who's infected and shedding the parasite, standard person-to-person spread.
And contaminated water, linking back to that chlorine resistance.
Exactly. Swimming pools, lakes, rivers. Also travel to places with less reliable water sanitation.
Direct livestock contact is another one. Farms, petting zoos.
Yep. Animals can carry it, shed it in their manure, so direct contact is a risk.
Foodborne transmission, too. Your notes mention raw milk specifically.
Right. Raw milk is a known risk, but also potentially things like contaminated meat, shellfish, even fruit and veg if they're not washed properly.
And lastly, hospital exposure. So healthcare settings.
Yeah, nosocomial spread can happen, especially if someone's got really bad diarrhea and infection control isn't absolutely spot on.
Okay, that's quite a list. Weak immunity, close contact, water, livestock, food, hospital. Maybe like a WLFH reminder, something like that could help lock it in for revision.
Now, the pathophysiology. What's actually going on inside the body once someone ingests those oocysts? The notes break it down. So they get swallowed, travel to the gut. There, the oocysts break open and release these things called sporozoites. They're the infectious stage. These sporozoites then invade the cells lining the small intestine, the epithelial cells, and once they're inside, they start multiplying like crazy.
Okay, so they're damaging the gut lining.
Exactly. That invasion and multiplication causes inflammation, damages the cells, and messes up the gut's ability to absorb water and nutrients properly. That's malabsorption. And that's what leads directly to the main symptom of the watery diarrhea, plus the cramps and pain. Your notes also mention, importantly, that sometimes, especially in immunocompromised people, the infection can spread. It can go beyond the gut to places like the lungs or the biliary system, causing different problems there.
Right. Okay, so watery diarrhea. Loads of things cause that.
Right.
When you're seeing a patient, what else is on the list? When should crypto jump out in the differential diagnosis based on these notes?
Well, the notes suggest thinking at it strongly anytime someone has diarrhea plus one of those risk factors we just talked about: recent swimming, travel, contact with a case, or, importantly, if they're immunocompromised.
So the differential list itself is pretty wide.
Oh, yeah. You've got your standard bacterial causes, viral gastroenteritis, maybe even thinking about IBD flares or non-infectious stuff. And the notes give a good list of specific bugs to consider ruling out. Things like Campylobacter, E. coli O157, Salmonella, Shigella, Giardia, norovirus, rotavirus, even amoebiasis.
Wow, okay. That really highlights why you can't just guess.
Absolutely. As the notes say, you really need lab tests. Stool sample testing is key to actually confirm it's crypto and not something else.
So maybe a good revision question is, patient comes in, watery diarrhea, just got back from a trip where they swam in a lake. What's high on the list and what test nails the crypto diagnosis? Kind of connects those dots.
Yeah, exactly. Now, epidemiology, where and when does this tend to show up? So in the UK, the notes state it's notifiable. Public health keeps track. There's often a seasonal peak, typically late summer, early autumn, and outbreaks are commonly linked to households, nurseries, swimming pools, sometimes those bigger water supply issues we mentioned. It hits all ages, but again, it's much more severe in the immunocompromised.
And globally.
Much more common in developing countries. It's a major issue for young kids and people with HIV there. The stats in your notes are pretty stark, like 3 to 13% of kids with diarrhea in some underdeveloped areas might have crypto, versus maybe 1 to 4% in developed countries. Really shows the impact of sanitation.
Okay, so we know who gets it, how, where. What does it actually look like clinically? What symptoms are listed in your notes?
Well, the big one, we keep saying it, is watery diarrhea, often quite profuse. Alongside that, usually abdominal pain, cramping, maybe nausea, sometimes vomiting.
But the notes stress a difference for immunocompromised patients.
Absolutely. That's a critical point. In someone with a healthy immune system, it's usually unpleasant but self-limiting, maybe lasts a week or two. But in someone immunocompromised, it can be relentless. Severe chronic diarrhea lasting weeks or months, leading to really significant weight loss, dehydration, malnutrition. It can be incredibly debilitating, even life-threatening.
Wow.
And the notes also mention those less common symptoms if it spreads outside the gut, maybe a cough or breathing issues if it hits the lungs, or jaundice and liver problems if it affects the biliary tract.
Got it. And other details the notes add, incubation period.
Typically around 5 to 10 days, but the notes say it can be up to 28 days, so quite a range.
And duration in healthy people is usually up to 2 weeks.
Yeah, roughly. Might also get a low-grade fever, feel generally unwell, lose appetite, anorexia. Oh, and the notes mention asymptomatic infection can happen, especially in developing countries, though it seems rarer in developed settings.
Okay, so diagnosis. How do we actually confirm it? Your notes are clear. Lab tests on stool samples.
Yep, that's the cornerstone. And the notes detail the specific lab techniques. A classic one is using special stains, like acid-fast stains. The modified Ziehl-Neelsen, ZN stain, is mentioned specifically. What happens is the tough outer wall of the crypto-oocysts picks up the stain, making them appear as bright red or pinkish dots against a blue or green background under the microscope. That visual is key.
So you can actually see the parasite cysts.
Exactly. The notes also list newer methods: immunofluorescent assays, IFA, ELISA tests, and PCR assays.
And PCR.
PCR, polymerase chain reaction, is highlighted in the notes as the most sensitive. It detects the parasite's actual genetic material so it can find it even if there aren't many oocysts in the sample.
Right. And the notes mention other tests might be needed too, especially if it's severe or dragging on.
Yeah, things like a standard stool culture to rule out bacterial causes. Blood tests like urea and electrolytes, UNEs, are crucial to check hydration and kidney function because of the diarrhea. And maybe liver function tests, LFTs, if there's any suspicion the biliary system is involved.
And for immunocompromised patients.
The notes say you might need tests for their immune status itself, like CD4 counts for HIV patients, to gauge how suppressed their immunity is.
Okay. For that stain, maybe remember. Cryptocysts are red. Modified ZN led the way. Something catchy.
Sounds good. So moving on to management, what do the notes say about treatment? The absolute foundation, especially for healthy people, is supportive care, mainly hydration. Preventing and treating dehydration from that watery diarrhea is priority number 1. Oral rehydration solutions, sometimes IV fluids if needed.
And specific drugs against the parasite.
The notes say antiparasitic meds are generally reserved for severe cases or for immunocompromised individuals. Dipping into the additional info section of your notes, for immunocompetent people, often just supportive care is needed. The infection usually clears on its own. For HIV patients, a key step mentioned is starting or optimizing their antiretroviral therapy, RD. Boosting their own immune system often helps them clear the crypto.
What about specific anti-crypto drugs?
Nitazoxanide is mentioned. It's used particularly in the immunocompromised, although the notes interestingly state it seems more effective in immunocompetent people. Rifaximin is also listed for severe cases. But the notes are quite realistic here, acknowledging that the evidence for truly effective drug treatments is limited, especially for the immunocompromised, and there isn't strong evidence for lots of other drugs sometimes tried.
Okay, so treatment isn't always straightforward, which makes prevention even more vital, right, given how easily it spreads and its resistance.
Exactly. Prevention is huge. The notes list the key strategies. Good personal hygiene, hand washing is critical. Ensuring safe drinking water and food preparation. Pool hygiene is a big one, not swimming when you have diarrhea and for a period after. And strict infection control in hospitals and care homes.
Yeah, the notes mention exclusion periods from school or work, and those swimming restrictions are really important practical points.
And a key point from the notes, there's currently no effective vaccine.
No vaccine yet.
Okay.
Any other specific control measures mentioned?
Yes, things like careful management of animal manure on farms to reduce environmental contamination. And, crucially, using the right disinfectants. Since chlorine isn't great, the notes actually list disinfectants that do work effectively against the oocysts. Things like chlorine dioxide, hydrogen peroxide, ammonia, and ozone. You need stronger stuff.
Ah, okay, that's a really useful specific detail. And then there was that surprising bit about rotifers.
Oh, yeah. Here's where it gets really interesting again. The notes mention these tiny aquatic creatures, rotifers. Apparently, they can actually help control crypto levels in water because they eat the oocysts, like tiny little natural water filters.
Nature finding a way. Okay, finally, prognosis and complications. What's the likely outcome?
It really hinges on immune status, as the notes emphasize. For healthy individuals, the prognosis is generally very good. They get sick, feel rough for a bit, but recover fully, usually within a couple of weeks. But for immunocompromised individuals, the outlook is much more serious. The infection can become chronic, severe, lead to major complications, and significantly impact mortality.
And what are those main complications listed in the notes? Again, more common in the immunocompromised.
Yes. Malnutrition is a big one, from the chronic diarrhea and malabsorption. Then there's the risk of the infection spreading to other organs, lungs, biliary tract, causing specific problems there. And the notes also mention post-infectious irritable bowel syndrome, or PIIBS. Some people develop ongoing gut symptoms like pain and altered bowel habits even after the infection itself is cleared. So yeah, the overall prognosis really varies depending on whether complications develop and the person's underlying health, especially their immune function.
Wow. Okay. We have literally walked through your entire set of cryptosporidiosis notes, from definition, causes, risks,
Pathophysiology, differentials, epidemiology.
clinical picture, how to test for it, management options, outcomes, complications, and all those prevention details. Hopefully, this deep dive has really distilled that dense information, making it more accessible and memorable for your revision or just for anyone wanting to understand crypto better.
And maybe a final thought, building on that resistance and spread we talked about, thinking about the notes, what do you reckon are the biggest public health challenges crypto still presents? Even in countries with, good water treatment. Something to mull over.
Definitely something to think about. And look, if you are in the thick of revision, maybe for something like the MSRA exam, these notes seem geared towards, remember, there are dedicated resources. You can check out pastthemsra.com. They have specific materials. Or for some free starting points, there's also freemsra.com. Might be worth a look. Thank you so much for joining us on this deep dive into your cryptosporidiosis notes. We hope breaking it down this way was helpful.